In this lesson, we will study Chapter 16, which covers certain conditions originating in the perinatal period, with code range P00 through P96. This lesson focuses on newborn and neonatal coding rules that are frequently tested on CPC and CCS examinations. This lesson is for educational purposes only. Please refer to official ICD-10-CM guidelines. Learning objectives. By the end of this lesson, students will be able to define the perinatal period, apply general Chapter 16 coding rules, assign the correct principal diagnosis for newborn records, differentiate maternal versus newborn coding, correctly use Z38 and Z05 codes, identify clinically significant newborn conditions, apply prematurity and low birth weight rules, correctly code neonatal sepsis, stillbirth, and COVID-19, and avoid common CPC examination errors. Perinatal period definition. For ICD-10-CM coding purposes, the perinatal period is defined as the time before birth through the 28th day following birth. Conditions that originate during this time frame are coded to Chapter 16, using codes from P00 through P96. Maternal versus newborn record rule. Chapter 16 codes are never assigned on the maternal record. Likewise, Chapter 15 obstetric codes are never permitted on the newborn record. This separation between maternal and newborn coding is absolute and is heavily tested on CPC examinations. Use of Chapter 16 codes beyond neonatal period. If a condition originated during the perinatal period and continues later in life, the perinatal code may continue to be used, regardless of the patient's age. The determining factor is when the condition originated, not the patient's current age. Principal diagnosis for birth record. When coding the newborn birth record, a code from category Z38, live-born infants according to place of birth and type of delivery, must be assigned as the principal diagnosis. Z38 codes identify the place of birth and the type of delivery. Z38 important rules. A Z38 code is assigned only once, at the time of birth. It is used only on the newborn record, not on the mother's record. If the newborn is transferred to another facility, Z38 is not reused at the receiving hospital. Other chapter codes with pages codes. Codes from other ICD-10-CM chapters may be used with Chapter 16 codes when they provide greater specificity or when a definitive diagnosis has not been established. However, if the reason for the encounter is a perinatal condition, the Chapter 16 code must be sequenced first. Birth process versus community-acquired conditions. If a newborn condition could be due either to the birth process or to a community-acquired cause, and documentation does not specify which, the default assumption is that it is birth-related. In that case, a Chapter 16 code is assigned. If documentation clearly states the condition is community-acquired, Chapter 16 codes must not be used. Clinically significant conditions. All clinically significant conditions identified on routine newborn examination must be coded. A condition is clinically significant if it requires evaluation, treatment, diagnostic testing, extended hospital stay, increased monitoring, or has implications for future healthcare needs. Use of Z05 codes. Codes from category Z05 are used when a healthy newborn is observed and evaluated for a suspected condition that is ruled out after study, and no condition is found. When not to use Z05. A Z05 code should not be assigned if the newborn has signs or symptoms of a suspected condition. In those cases, the sign or symptom is coded instead. Z05 on birth vs readmission records. On the birth record, Z05 codes are assigned as secondary diagnoses, following the Z38 principal diagnosis. On readmission, when Z38 no longer applies, a Z05 code may be assigned as the principal diagnosis. Z05 codes are used only for healthy newborns. Assigning additional perinatal codes. Additional perinatal diagnosis codes are assigned for conditions that require treatment, further investigation, prolonged hospitalization, or increased resource utilization. Future healthcare needs. Codes must also be assigned for conditions documented as having implications for future healthcare needs. This rule is unique to perinatal coding and does not apply to adult patients. Prematurity coding rule. A code for prematurity should not be assigned unless it is specifically documented. Prematurity and fetal growth conditions are coded using categories P05 and P07. Birth weight and gestational age. When both birth weight and gestational age are documented, two P07 codes must be assigned. The birth weight code is sequenced first, followed by the gestational age code. Low birth weight status, later life. Codes from category P07 may also be used in children or adults when prematurity or low birth weight affects the patient's current health status. Bacterial sepsis of newborn, P36. If a newborn is documented with sepsis and the type is not specified, the default assumption is congenital sepsis. In such cases, a code from category P36 is assigned. Organism coding with P36. If the P36 code identifies the causal organism, no additional B95 or B96 code is assigned. If the organism is not identified, an additional B96 code is assigned. If severe sepsis is present, assign R65.2 and any associated organ dysfunction codes. Stillbirth, P95, code P95, stillbirth, is used only in institutions that maintain a separate stillbirth record. No other codes are assigned with P95, and it is never used on the maternal record. COVID-19 in newborn. If a newborn tests positive for COVID-19, assign U07.1, along with any applicable neonatal manifestation codes. Congenital COVID-19. If documentation states that COVID-19 was acquired in utero or during the birth process, assign P35.8, other congenital viral diseases, along with U07.1. Z38 with COVID-19. When coding the birth episode, Z38 remains the principal diagnosis, even when COVID-19 is present. COVID-19 codes are assigned as additional diagnoses. Common CPC exam errors. Common examination errors include assigning Chapter 16 codes on the maternal record, failing to assign Z38 as the principal diagnosis, incorrect use of Z05, coding community-acquired infections as perinatal, and incorrect sequencing of birth weight and gestational age codes. Exam recall summary. Remember, P codes are for newborns only, Z38 is the principal diagnosis at birth, Z05 is used for observation with no condition found, birth weight is sequenced before gestational age, neonatal sepsis defaults to congenital, and Chapter 16 codes may be used beyond the neonatal period. Lesson 18 Summary. In this lesson, we reviewed the definition of the perinatal period, maternal versus newborn coding separation, correct use of Z38 and Z05, clinically significant newborn conditions, prematurity and low birth weight coding, and rules for neonatal sepsis, stillbirth, and COVID-19.